think of sports, when you think of good health, you probably don't think of Leonardo da Vinci. But it was he who said the human foot is a masterpiece of engineering and a work of art. The orthopedic and sports medicine experts of Trinity Health System would agree, which is why they are here to remind us that to every champion, health matters.
The foot and ankle is a very interesting area because it has 28 bones, 35 joints, 119 ligaments, 20 tendons, 5 nerves, 3 arteries, multiple veins, and a lot of other soft tissue things. But if you just think about the complexity of the foot and ankle, it makes it very easy to get injured just because of the sheer number of structures that are there in the foot, plus the fact that we are walking and running on the foot all the time. So athletes in particular can have specific injuries to foot and ankle.
The key to having healthy feet for most people is comfort. Pain is not normal. If you're having pain or discomfort with your feet, that's the first sign that something is wrong. A number of things can cause pain, from genetic deformities, the way that our feet are structured when we're born, the types of shoes we wear, the types of activities we do. We see a lot of people with foot pain that work 10, 12-hour shifts on hard concrete surfaces, which create a lot of stresses and lead to a lot of different pain and deformities in the feet. Shoes play a very large role in foot health and in foot comfort. We see in the summertime a lot of patients coming in with multiple foot injuries because of flimsy shoes, flip-flops, sandals, things of that nature. Now certainly those are fine to wear in the right situations, but wearing them too often in the wrong situations can lead to foot injuries. We see people working in different occupations that are wearing the wrong shoes for their occupation, whether it's an unstable shoe when they're working in an unstable environment such as uneven ground, rocks and gravel. We see people wearing shoes that don't provide enough cushion or support when they're on hard surfaces all day. So the right shoe for the right environment is very important for foot health and foot comfort. Some of the more common foot injuries we see, ankle sprains are probably the most common. They're the most common sports injury. We see ankle sprains from patients that are on uneven surfaces and may not have adequate fitness or ankle strength for the activity they're performing. Day-to-day injuries, plantar fasciitis, which people commonly refer to as heel spurs or heel pain, is probably the most common foot pain that we'll see in the office.
Almost all people have either had a plantar fasciitis or having it now or will have it. So essentially, it's something that every person is going to get at some point in their lives. And it's not a certainty, but that's very common to have. And plantar fasciitis is essentially pain on the bottom of the heel. There are some other conditions that can cause that pain, but in athletes who have tight calf muscles, there's sometimes pain on the bottom of the heel, and that results from irritation of the attachment of plantar fascia where it hooks on the heel. Plantar fascia is basically a flat sheet of muscle that runs on the bottom of the foot that holds up the arch. So anything that puts stresses on the arch of the foot is highly likely to cause plantar fasciitis. So one of the ways to prevent that would be to use either arch supports, make sure to keep your calf supple by doing calf stretching exercises, and to use appropriate footwear with cushioned heels to prevent any rapid or repeated beating on this plantar fascia attachment.
We see a lot of people with flat foot problems. Flat foot problems can lead to a multitude of foot pains and foot deformities, from plantar fasciitis and arch pain to different types of tendinitis. We see a lot of flat foot problems exacerbating or creating bunions occurring more rapidly than they normally would. A lot of patients will have bunions and hammer toes, which are quite painful in their shoes and require alterations in their shoes to fit comfortably. Most of the time, these digital deformities such as hammer toes and bunions are genetically related, but the things that we wear shoe-wise and the activities we do can cause them to exacerbate and be more painful, maybe more quickly than they normally would.
The other important aspect we see is sometimes Achilles sprains or Achilles tears. That's common in younger kids playing basketball especially, or any sports that involve a lot of jumping. And if the ankle hurts in the back, then that's something you're looking for. there's a very good way to actually avoid injuring the Achilles, and that's to consistently stretch your calf muscles, hamstring muscles, and your quad muscles. So you're not having to work an Achilles that's really tight to begin with. You start off with a nice supple Achilles, warmed up, and then you play sports, you have lesser chance of getting injured. And one thing which I would like to stress about in the foot and ankle injury world is stress fractures. These are common in foot and ankle, especially the fifth metatarsal, which is the bone on the side of the foot, and a navicular bone, which is a prominent bone on the inside of the foot. People who do a lot of sports, a lot of running, maybe putting 10-12 miles of running every day, these people can get stress fractures of the foot, which makes it very difficult for them to walk or run. And I think the biggest point that can tell you that you need to go and see someone specific is inability to walk. So if you're not able to bear weight on a foot or a side, that tells you that it's not something that's just a simple sprain or something that can just heal by itself. So you want to get that evaluated. The other thing you want to get evaluated is if there's recurrent swelling in any specific joint, then you want to get that taken care of. If you look at a foot or an ankle, for any athlete who's running and playing any kind of high impact sport or is on the field, and the athlete has a pop or feels some pain and is not able to bear weight, that's a red flag. Every normal person who does not have a fracture should be able to take 4 steps without having to stop walking. Other than a problem with this spot, this is an area where it's called a syndesmosis. And with ankle sprains, normal injury is at the ATFL, which is this X mark. So if you see the big bony bump on the outside of the ankle, the front part of that is where the ligament of the ankle attaches. That is the most common to be injured in an ankle sprain. That is a simple ankle sprain. This person can tape the ankle, get an ASO brace, and can go back on the field if he wants to. But in association with that, if he has pain that's higher here, that's called a high ankle sprain, and it involves a ligament that connects the outside bone and the shin bone. You do not want to go back to sports if you hurt here. If you hurt there, it's okay to go back. Here, you want to get that evaluated, because if there's instability because of a ligament problem here, that can cause major troubles in the future. So this is a point you want to stop and not get back to sports. These injuries, some of them are preventable. The way to prevent them is to, as usual, do stretching exercises, but on top of that, keep a good diet. Make sure you have enough calcium, vitamin D in your system. A few good sources of this would be milk and milk products, white meat, fish. These are good products for your calcium and vitamin D intake, and they help the body and bones a lot. The other thing you can do for your feet, the least you could do is avoid barefoot walking on unlevel ground. Use comfortable cushioned shoes that help you for your foot structure. A stability shoe is useful for a foot structure which is more unstable or a flat foot kind of a foot, and a comfortable cushion structure of comfortable cushioned shoe is a better shoe for a high arched foot which needs more cushioning. But if you use good cushioned comfortable footwear, and if you do good exercises, you can prevent a lot of these injuries.
Every champion's journey starts with a single step. The orthopedic and sports medicine experts of Trinity Health System will be back next week. So stay tuned, stay one foot in front of the other, and stay healthy.